Tonight, our newest installment of Addicted Iowa is focusing on the opioid epidemic and the staggering surge in people dying in it. New data shows deaths connected to opioids are up 35% over the last year, but now there is work being done to try to save those lives. Iowa's News Now reporter Jillian Brooks joins us live tonight in Cedar Rapids and tells us how anyone in the community can play a part in saving those lives.
Mitch, here at the Cedar Rapids Police Department, you'll find the Eastern Iowa Heroin Initiative, a program started in 2015 to help prevent the amount of deaths we're seeing from overdoses here in our community, whether that's through treatment or preventing an addiction altogether through prevention.
We're that first contact, and we can be a warm handoff between someone who is suffering from a substance use disorder and treatment that could be literally in their backyard.
Lindsay Powers with the Eastern Iowa Heroin Initiative says no officer believes they will be able to arrest their way out of the opioid epidemic.
Because there are people who are out there who are profiting off of the misery of others when it comes to this, and so that really is our primary role in addressing this particular issue.
Preventing losing more Iowans to an overdose is to keep them out of the cycle altogether. That effort starts with one person at a time.
All diverse groups of community members. You know, we want our business people and our friends and family members, our, other health professionals, community groups.
The Area Substance Abuse Council's prevention services spans across 7 Iowa counties. A variety of services, grants, and trainings is their part in slowing down the epidemic. This month, they have campaigns launching on prescription drugs and battling the stigma of drug users.
It's really important, I think, because stigma is a great barrier to those seeking treatment. And if we can reduce the stigma, I think that will definitely help move more people in that direction.
Naloxone is an overdose reversal drug. ASAC provides training so more Iowans have the ability to save someone in an urgent situation.
Providing that training to empower people that they can help save a life.
The statewide telenaloxone program allows Iowans to talk to a pharmacist online, then have that medication shipped directly to their homes.
It helps reduce that stigma too, because a lot of people they could still be afraid going to the pharmacy just because of that stigma surrounding it, but it's nothing to be ashamed of.
An opioid addiction is a hard cycle to break, but those involved with prevention efforts believe recovery is possible.
We just want to divert people from just jail or the hospital. We want to help them get better.
If you're interested in bringing prevention efforts into your community, you can find out how you can get involved right now at iowasnewsnow.com. Live in Cedar Rapids, Jillian Brooks, Iowa's News Now.
We begin tonight with a new report in our series, Addicted Iowa. We're focusing on gambling and how it's far easier now for Iowans who can do it with the click of a mouse. Iowa's News Now reporter Jillian Brooks takes a closer look and where help can be found when gambling is no longer for fun. Jillian?
When casinos first closed, the number of calls to 1-800's Bets Off saw a decrease. That doesn't necessarily mean Iowans weren't gambling. Lottery, mobile games, and sports betting, which has become a lot more popular recently.
The number of sports wagering individuals is increasing as well.
Iowa casinos have seen some of their best months for sports betting this year. They've racked in $100 million of revenue since January.
The percentage of those placing bets online versus going retail was between 70 to 80% in each of the past several months. So they're doing more online as it relates to sports wagering.
Now gamblers can even create an account online and place a bet within minutes.
January 1st of this year, you no longer had to go into a casino to set up your account. You could do that remotely. And so that just created more interest, to be able to have multiple accounts. But
Iowans can press their luck on apps like DraftKings, William Hill, and FanDuel, but they are forced to make help easily accessible inside their apps.
Maybe they've lost money for the first time more than what they planned to, and they just need to talk through someone and say, okay, so how do I avoid from doing that the next time?
Problem gambling is hard to spot. So advocates say making the resources readily available can help.
It's when we start seeing that pattern over and over again that then it may be important to come in or whether virtually or face to face, to talk with a gambling treatment professional.
Hitting big can have the same rush as any other substance abuse disorder.
For a gambler, they to get the effect that they're seeking. They have to go out and do more and more and more. And, maybe it was $100 bet. Now they have to get $200 a bet of bets to get that excitement, or 300 or 400, which is no different than someone who has a problem with alcohol. They have to continue ingesting more and more of a substance.
He says people can look at gambling as a solution.
I'm just one more win from fixing all my financial problems that have been caused by my gambling.
But treatment may be the only solution to fix addictive behavior.
Just overall with addiction is how do we get beyond describing the person as someone who's addicted rather than this is a person who is struggling with an addiction.
Information for gambling addiction and how to receive help can be found online at iowasnewsnow.com. Jillian Brooks, Iowa's News Now. Across the country, 88,000 Americans lost their lives to an opioid overdose in 2020. Iowa is seeing that same trend, but the switch to virtual treatment has the state seeing an increase in Iowans looking for help.
When you call support groups and you say, my son died of an opioid overdose, there really wasn't any kind of support that understood.
Crush of Iowa found its roots in Cedar Rapids for that exact reason, helping people find support.
When we started in 2016, the opioid epidemic was getting a lot of attention politically, news-wise.
While COVID-19 has taken over that focus this past year, the opioid epidemic has only gotten worse.
While we can't say that the pandemic has caused an increase, what we can say is that there's the possible that it has had an impact.
In 2019, 157 Iowans lost their lives to an opioid overdose. In 2020, that number rose to 212, a 35% increase.
Respiratory depression is the primary cause of overdose death with opioids. And if a person can't see another person going through that, the individual that's using is unable to administer Narcan to themselves.
Synthetic opioids play a major role in that increase. 76% of deaths in 2020 are related to fentanyl.
A synthetic opioid like fentanyl is estimated to be anywhere from 50 to 100 times, more potent than heroin.
The state has seen a dip in people being admitted for treatment services. However, during the pandemic, some centers opened their computers for virtual treatment for the first time.
Within a month of COVID, they were up to about 86% of our providers were utilizing telehealth services.
For Crush of Iowa, the virtual opportunity has expanded their community.
As we talk to clients in these groups, when they get out, they go to different parts of the state. Mm-hmm. And then, they tell their family members about it.
While treatment has become more accessible for some through virtual options, the Iowa Department of Public Health worries for the future of the epidemic.
We are, just seeing the beginning of the impact for individuals with a substance use or mental health issue.
The Substance Abuse and Mental Health Services Committee has began allocating funds to IDPH relating to the opioid epidemic and its relation to the pandemic. Officials said they have already began thinking of how those services will be delivered. Jillian Brooks, Iowa's News Now.